Hello and welcome to another episode of the Caring Support Podcast, your healthcare podcast that cares, and the show where we dive deep into the world of healthcare and explore the incredible stories and experiences of the unsung heroes who work tirelessly to keep us healthy. I'm Kaylee, I'm your host, and I couldn't be more excited to embark on this journey with all of you today because we have an amazing guest with us. We have registered nurse change agent, transformational leader, public speaker, nurse consultant, and health equity activist. Welcome, Birgit. I am so excited that you are here with us today.
Thank you, Callie. I'm so excited to be here with you this morning.
So why don't we start off strong and just tell us a little bit about yourself?
My name is Birgit Umaigba. I'm a registered nurse. I'm a nurse educator as well. I work at Centennial College in the BSN program as well as the bridging program. I also am a public speaker, a nurse consultant, and a health equity activist.
That is a lot to have on your plate.
Yes, it is.
What made you go into nursing as a career and then move into everything else that you've kind of added on top of that?
Interesting. I always shied away from nursing. I'll tell you that. I was more of, tending into administration. At one point, I wanted to study pharmacy. I wanted to study medicine. So nursing wasn't on my radar. I started nursing as a mature student, and at the time, I actually wanted a profession that would allow me to get into the workforce as quickly as possible. And I was advised by a career counselor that nursing would be it. So I'm like, is that it? So I decided to do nursing, and I loved it. And I have loved every bit of it from day one, from the classroom setting to working at the bedside to teaching at the college and the university, to now speaking publicly, to advocating for social justice issues, for health equity. It's just been a life changer for me. I've learned so much as a nurse. Nursing has changed me in as much as people say we save lives in quotes. Nursing has saved me in many ways.
Yeah, you just mentioned like you're big on change. You want to be a part of the change. And I think there's a lot of people out there that are trying to make those steps right now. So could you discuss maybe some of the key challenges you've encountered in that area and maybe some of the strategies that you're trying to employ to create the positive changes that you're looking for?
Yes. So change is a process. I would say change is on the continuum, and in order to be a part of change, oftentimes we have to position ourselves in a way that allows for change to happen. I say that especially in nursing, being an advocate within a profession that is predominantly female and often silenced, it can be hard to be an advocate within the nursing profession. So I have learned to be able to adapt to different types of work within the nursing profession in order to do this work. I've been a part of, advocating for better pay for nurses. And speaking out in terms of the working conditions for nurses, especially during the pandemic. And that hasn't come without consequences for me. And in order to see this change and be a part of it and facilitate it, I think that positioning myself when it comes to work flexibility has allowed me to continue this work.
So you're also a nurse consultant. So what does a nurse consultant do? And what do you do as a nurse consultant to provide expertise to healthcare organizations? Maybe you can share some examples of the areas that you're working in right now that you're trying to improve.
Yes, my consultancy is mainly focused on individual nurses. Precisely, that was birthed to support internationally educated nurses who reside here in Canada. As we know, there are thousands of internationally educated nurses that are currently living in Canada who are unable to practice. And now I want to say in Ontario, because some of the provinces have found ways to help internationally educated nurses transition faster into practice, given the nursing shortage. And provinces like Nova Scotia, Alberta, and British Columbia recently launched pathways for internationally educated nurses to be able to practice. Ontario hasn't followed suit. So my consulting is mainly focused on helping internationally educated nurses navigate through the process. I also liaise with organizations when it comes to training nurses who work for agencies in terms of enabling them to be aware of the policies and procedures of different organizations that they go practice in. So I work with these agencies to train nurses and support them as they navigate through different hospitals to be able to maintain patient safety.
You also have a big position as kind of a public speaker and stuff now. You've done a few public speaking things. And that being such a powerful platform for you, what are some of your key topics or messages that you do address when you're asked to do these speeches? And what kind of messages would you like to share with us today?
A lot of my topics when it comes to public speaking center around women's health equity. I've talked on leadership, nurse retention, and I also I'm often invited to speak in colleges and university to discuss anti-racism in nursing, anti-discriminatory pedagogy within the nursing profession, and how to move the work forward when it comes to a more equitable workforce. So these are a lot of my topics. And recently I was invited to speak in one of the grassroots organizations that empowers asylum seekers to be able to navigate through the Canadian workforce. So it's a lot on social justice issues. I've also commented on immigration issues. I've been a part of conferences in regards to immigration and what it means for immigrants to settle in Canada and to be able to integrate. So when it comes to these topics, a lot of my speaking center around social justice and health equity.
So maybe we could dive into like just a couple of those little topics, just a little bit off to the side here. But what do you think we could be doing or should be doing when it comes to things like nurse retention and some of the other issues that you had mentioned?
Yes, when it comes to nurse retention, a big focus has been on working conditions, improving working conditions for nurses. As we know, the COVID-19 pandemic laid bare a lot of inequities within the workforce, especially in the nursing profession. We saw a lot of nurses quit as a result, and nurses are still quitting in droves. So when it comes to nurse retention, we're looking at better working environments for nurses, increased mental health supports. If you're a lot of times, if you're not a full-time staff at many of these organizations, you're not entitled to mental health supports. You feel disconnected, and people, even though these nurses are working full-time hours and actually bearing the burns, oftentimes they still are not supported that way. A big part of my work as well was, rallying with nurses, bedside nurses, and we in for the repeal of Bill 124. As we know, the bill was deemed unconstitutional by an Ontario court, and which unfortunately was later took to appeal by the government. But recently we did have some wins with nurses, Ontario nurses, registered nurses, seeing an increase of 11% in their wages for the next 2 years. So that's a win, although we still have many steps and a long road to go when it comes to making that equitable for all nurses. Most people do not know that registered practical nurses are not a part of the wage increase. Nurse practitioners are not a part of the wage increase. So we want to see more equity around the nursing profession in general.
Yeah, I think that's probably one of the most important things is to make sure that there is equity there.
Yes.
Without it, yeah, obviously people are going to walk away. People do that for any job,
That's
right?
right. That's
But
right.
you guys do so much work. I mean, you just told us that you were coming off a night shift and here you are sitting with me. And like frankly, I mean, the only night shift I've done has been, nursing my babies and stuff like that. But I mean, that's it's still tough to go from like you're up all night and then now hey, look, you're here. So yeah, like what you guys do is very important. And I think it's amazing that you're bringing such a huge light to it and that you're using your position for such a good power. I think that's absolutely amazing. So thank you very much. And maybe you could explain a little bit more about the health equity side of things and why that's important to you.
Thank you. Health equity, as we know, is a big part of any system. And if people are paying attention, we'll find out that not people are not being treated, the same way in the society, especially marginalized groups are often treated disproportionately in the healthcare system. As someone who represents her as a Black woman, I have experienced, health inequities within our healthcare system, and I have seen inequities play out as a registered nurse providing care. During the COVID-19 pandemic, we actually saw how the vaccine rollout was done with certain areas being prioritized. We saw how vaccines advocates had to call out the system on how vaccines were being rolled out, with areas with certain postal codes getting the vaccines and areas with other postal codes, being the last, despite the increase in the spread of the virus in those areas, which are often more crowded. And then when it comes to health equity, I remember a big win for me and the many nurses who spoke out was the prioritization of pregnant women for the COVID-19 vaccine administration. And that was a big one. And also I did start a petition for free rapid antigen tests, which actually garnered over 150,000 signatures all across Canada. And we eventually did see a lot of people support that petition, and we actually saw free rapid antigen tests being distributed in most provinces in Canada. So health equity for me is speaking out on the things that often are neglected, prioritizing marginalized groups and making their voices heard, because most of these groups are often unable to speak for themselves. So for me, it is important to use my privilege, however small, to prioritize the groups that are often silenced or not even mentioned at all.
A lot of this comes back to leadership. It becomes that big elephant in the room, so to speak. And one of your focuses is transformational leadership, and it's an integral part of who you've become. How do you approach leadership in the nursing field? What qualities and skills do you believe are crucial for driving transformational change?
Yeah, great question. For me, transformational leadership is a leadership style that actually focuses on inspiring others to lead, right? Because we need others to join in the work, whether it's advocating for more equitable workplace or better wages. It takes everybody to get along. So for me, it is having a vision and being able to inspire others to follow through with the vision, having that charisma to bring people along, to build trust, to connect with people where they're at, to meet them where they're at, and bringing about a change, however small, celebrating the little wins. So I think I'd like to consider myself a transformational leader because I've been able to inspire so many people in different areas, whether from the parts of speaking up for themselves. I know of many nurses who have reached out to me and said and asked for support in terms of speaking up for themselves in dealing with workplace conflicts, inspiring them through their actions and words and behaviors, and just to see how they can succeed. I know within my community, a lot of youths do reach out to me. I do mentor them and support them through their goals and ambitions, and provide that real meaningful support, whether or not is providing references and guiding them through even getting into school. You'd be surprised how many people don't even know how to navigate the system and just to know what to do in terms of going into college. So I've been able to create a supportive environment in my role as an educator for my students, in my role as a nurse colleague to my fellow nurses who've been inspired to also reach for greater heights and do better for themselves. So for me, that is transformational leadership.
So we've taken a really good look at what's gotten you this far. So how about we take a look ahead into the future? What are your future goals and aspirations as a nurse, change agent, transformational leader, public speaker, nurse consultant, and a health equity activist? Oh my goodness, that takes so much. You're amazing. Are there any particular projects or initiatives that you're excited about pursuing in the future?
Yes, many.
Awesome.
But yes, I'm currently trying to see how the province of Ontario can transition internationally educated nurses to practice, because I do work with, and I do see internationally educated nurses. They're still being de-skilled. They're working in groceries as Uber drivers, in retail, and they're not able to transition to practice and to utilize the skills that they've learned and what they always desired to do as nurses. So I recently wrote a letter to the College of Nurses of Ontario to follow suit and take steps, just like other provinces like Nova Scotia, Alberta, and British Columbia have done, to transition INs. So INs meaning internationally educated nurses. And I did get a reply, and that there is some work in progress, and they're looking into it. I intend to follow up and see how that work in progress is playing out and what that looks like, because as we know, there's a shortage of nurses, and we do have nurses on ground already that are willing and ready to work. So that's one of my projects. And I'm looking into the future of research and how I can use research to inform the work that I do, and be able to impact my profession in a very positive way. I know that I'm doing that already, but I want to see how I can use research to inform my work, and I'm looking into a more global role where I can impact the world, no matter how small, and take my work to areas where it's also quite needed.
So thinking about, you mentioned that you do kind of mentor people, you mentor some students, you mentor some nurses, and we're going into back to school here right away. What advice would you have for current students or students that are returning to school to keep them motivated and keep them wanting to continue?
Yes, I always tell students, I say, stay in touch, be connected, connect with some grassroots organization, be a part of something that excites you, that interests you, because you never know what it's going to be kindled inside of you. And you just never know where your passion lies when it comes to the professional sphere. So so I'm going to repeat what I mostly tell students: stay in touch, connect with a grassroots organization, and see where your interests lie, and see how you can be a part of this amazing profession of nursing to make it better, because your voice matters. Every single one of you has a role to play within the profession, and it just doesn't end at, providing care to patients. There's more you can do to make the profession better and to bring it to a positive light, that and take it to a level where nurses are respected, because I think most people have done so much work to get us here, where nursing now is seen as in a positive light, despite the fact that the policies are still not saying that nurses are respected. But we do know that from the voices of the public, of patients, that nursing is a highly respected profession. So I really do hope that nursing students can further advance this and inform their practice in a very positive way.
Is there anything else that you would like to share with us today?
I think we covered a lot.
Yes, we definitely did. There was a lot there.
Yes. Well, you know what? I want to say thank you to every member of the public that has added their voices to supporting nurses in the fight for better working conditions, for more equitable pay. I want to say thank you, because we haven't gotten where we are today without the support of the public. So thank you.
Well, that brings us to the end of another inspiring episode of the Caring Sport podcast. I want to extend my deepest gratitude to our incredible guest, Birgit, for sharing your invaluable insights and experiences with us today. To all of our listeners out there, remember the dedication and passion displayed by our healthcare workers like Birgit are a testament to the power and compassion and the indomitable spirit of humanity. So let's continue to support and appreciate these remarkable individuals who work tirelessly to keep us safe and healthy. If you have any questions or comments or stories you'd like to share, please reach out to us through our website or social media channels. We love hearing from you and engaging in meaningful conversations. Lastly, don't forget to subscribe to the Caring Sport podcast on your favorite podcast platforms so you don't miss episodes like this one. Together, let's continue to learn, grow, and be inspired by these incredible healthcare workers who help shape our world. Thank you again for joining us today. And until next time, don't forget to do some self-care, show the healthcare workers in your life some love, and keep having those important conversations. Take care, everyone, and thank you so much for being our guest today, Birgit.
Thank you so much for having me.